medical examiners that are actual medical doctors, they're forensic pathologists, which is a specialty in the medical world. And so that is not the same as a doctor that you would see in an emergency room. And I think sometimes that's lost in the media when they go and they interview somebody that is an ER physician that's treating emergency cases. It's giving an opinion on the death of someone that's inappropriate because that's out of that particular physician's lane. That's not what they do every day. A forensic pathologist or medical examiner, now that is somebody that they are doing autopsies every single day. That is their practice. And so they would be really the only ones that can accurately explain that world. There's different levels of a exam in the autopsy suite. They may just open the skull and look at the brain and do some examination and take some tissue samples from there. They may just do an external exam where they withdraw blood and urine and other specimens, or maybe take a tissue sample from an organ. And then there's a full autopsy where that is, opening the body and then doing an internal exam on the tissues and the organs that are within it. So it just depends on the circumstances surrounding the death. Was it unattended? Was it sudden and unexpected? If someone dies in the hospital and maybe they're a hospice patient, they're typically not going to get an autopsy. That would be an example when they're not going to come in for a full autopsy, because obviously if it's a hospice patient, they have some sort of chronic known condition and they've been under the care of a physician. And so it's not sudden, it's not unexpected, it's not unattended. They've been under the care of nurses and doctors and things like that. So that really doesn't warrant an autopsy, because there's a pretty good indicator of, what caused them to die. Now, if there was a hospital patient that died, and even though they're under the care of a physician, if it was something suspicious, like, they had some sort of minor illness or injury, and it was unexpected that they died, and there wasn't some obvious wound on them that could have caused it, then maybe you would see them get an autopsy, because that could be a result of some sort of procedure was done incorrectly, or maybe there was a medicine that was administered and it was not the correct medicine. So that all needs to be examined.